Welcome back to Community Crossroads. The beginning of October usually marks a few things. Fall has just started, but so is flu season. Every year, 5 to 20% of the U.S. population will get the flu, and 200,000 people will be hospitalized for it. As with most illnesses, there are a number of misconceptions and myths about the flu, as well as the flu shot itself. Joining me to discuss flu season is Dr. Stephen Gartzman. He's with Victoria ER. Now, that's actually incorrect. As I was learning, is flu season's actually year-round. I didn't realize that.
Yes, this is the peak season beginning, and that's when we try to vaccinate the community to protect all of our families.
And it goes from October until
Till the spring.
Till the spring, essentially. Now, the flu shot, there are a lot of, as I was saying, misconceptions about it. I went through a period where I didn't get the flu shot for, I don't know, 5 years or so, where I just didn't want it anymore. And that is not the right thing to do.
It's very common. It's very common. You're not alone, and it's one of the reasons we try to get out into the community and educate the public on what it's all about and the reasons why we do it, why we encourage folks to do it.
Now, some of the, I guess, common beliefs about the flu shot that people have include that because it does have the flu virus in it, correct?
Correct.
That people will get sick just from the flu shot.
That's a very common urban legend, but not really untrue in the recent past, because prior vaccines used actually live and weakened viruses, and that's why some people would get sick, but that's not anymore. That's not in use anymore. The current vaccines, our technology is much better. The virus is actually killed or recombinant. There's no live virus in the vaccine anymore. And so there's no danger of getting the flu from the vaccine.
There is still the option of getting the live virus, isn't there, through the nostrils?
There used to be, but we don't use the flu mist anymore. It's not recommended for that reason, because it's live, and also the effectiveness is very poor. So it's we no longer use that either.
What is the effectiveness of the flu shot?
Well, it depends on which strain of virus that you get, but the short answer is anywhere from 40 to 60%. Higher if you happen to have a strain that's covered in the vaccine, and lower if you happen to get a flu bug that's not covered. But in general, it around 50, basically about 50%. But even if you get the flu or get a strain of the flu after the flu shot, you'll get much less sick than if you hadn't had the vaccine at all.
And I know there's a lot of conflicting ideas about when the flu shot should actually be, you should actually get it. When is the best time?
Well, the Centers for Disease Control recommends everyone get vaccinated by the end of this month of October.
Okay.
It takes about 10 days to 2 weeks for after the shot for your body to become immune, for the antibodies to rise in your system. But the recommendation is by the end of October for folks. Everyone above the age of 6 months.
Okay, everyone above the age of 6 months. And another belief about it is you can develop an allergy to the flu shot if you get it every year.
Well, there's certain contraindications. There's a segment of the population that can't have the flu shot, and that's one of the reasons why we recommend everyone do it, because we want to protect the folks that can't get the flu, because we lose thousands of folks that succumb to the flu. We lose folks, including kids, average of 100 to 150 kids every year to the flu. And so we want to protect the vulnerable members of our population that can't have the flu shot because they have contraindications to it. And if everyone gets it, then those folks are protected. And so it's one of the reasons we recommend it, because it helps save a life if you get the flu shot. Not just for your family you're protecting, but you're protecting the vulnerable in our population that can't have it.
And who are the most susceptible to suffering maybe a fatality or being hospitalized by the flu?
The groups at risk are the extremes of age, so the very young infants, and the very old, and then the folks that have weakened immune systems from either immunodeficiencies or cancer, for example, patients on steroids that can't fight off the flu. And those are the most at risk. Pregnant women are very vulnerable, although the flu shot now, the inactivated, is completely safe in pregnancy. We actually recommend pregnant women get it to protect them and their unborn children from birth defects and from miscarriages. So the extremes of age, the elderly, the young, the immunocompromised, and pregnant women are the most vulnerable.
How do you contract the flu? Is it through contact?
Yes, it's person-to-person contact, but even just us talking, if I had the flu, even talking to you and just basically breathing the same air, within 6 feet is the basically the range that the CDC gives. But anyone coughing, sneezing, or even talking, you can pass the flu. Touching something, if I have the flu and I touch this desk and you put your hand on it, put your hand in your mouth, you'll get it.
And the Victoria ER, you will offer the flu shot there?
Every year we offer free flu shots. We have a health fair and we offer free flu shots to the community while supplies last, and as trying to get everybody on board and get vaccinated.
Now, I know your health fair is happening today, but by the time this airs, the health fair will in fact be over. But you're actually having a blood drive at the health fair for Harvey victims or hurricane victims?
Yes, sir. The hospital's stocks are low since the hurricane, so we're trying to help replenish their supply with a blood drive as well.
And if people want to get in contact with Victoria ER, how do they go about doing that?
Our website is www.victoriaer.com, or just Google Victoria ER and we'll pop right up.
All right, sir. Thank you very much for your time.
Thanks for having me.
I really appreciate it. All right, stay with us. We will have some more Community Crossroads right after the break.